My name is Raegan Cury, and I'm from Jacksonville, Florida. I was born and raised here. I graduated from high school and college here. I got married and started a family here. And I also had a life-saving lung transplant here.
What I love most about Reagan is the fact that she is a survivor in all ways, shape, or form. She will not give in.
Growing up, Reagan was amazing. She started doing gymnastics when she was, I think, 5. She and her cousin wanted to do cartwheels, and when she got to 150, Bill made her go sit down.
She placed first in the Southeast Regional balance beam competition and was in the top 50 in the United States at that time.
Well, she's very short, but even though she's very short, she's definitely one of the most passionate and fiery people you ever meet. I love it about her. She's great.
She's always just knows exactly the same page that I'm on, and I think that's probably because we're so similar.
When you've come so close to losing a family member, it's definitely a very sobering experience. You realize that everything could have been so different, and it makes you appreciate every moment so much more. She is one of the biggest inspirations of my life.
In early 2002, I developed a cough that would not go away. So my husband, being a pulmonologist, told me to go in for a chest x-ray, which I did, and it revealed what looked like pneumonia in my right lung.
And I didn't really think that it was going to be bronchoalveolar lung cancer at the time.
The surgeon, when he got in there, the further up the lung he went, the more cancer he found. We were all in shock.
And when I woke up from that procedure, I had no right lung at all. It had to come out. So I went through 4 rounds of IV chemotherapy in an effort to try to prevent a recurrence.
I was 7 when my mom was diagnosed, and Davis was 3, I think. So being older, I do remember probably more than he does. But most of my memories from that time are really positive, which sounds weird. They did a great job at making us feel like everything was normal. Our grandparents lived with us when she was sick, and I'm so grateful because I'm so close with my grandparents. When my mom lost all of her hair from chemotherapy, that should have been, or seems like it should have been, a kind of scary and overwhelming thing for young kids, but all of my uncles and my mom's male cousins all shaved their heads with her, so it ended up being like a really fun day. I remember that day really well.
She had 1 lung and could still do 15 chin-ups, real chin-ups, boy chin-ups, which I've maybe knocked out 2 or 3 in a row when I was in really good shape.
She is strong, and we had hoped that that meant that her left lung would be okay.
Memorial Day, Friday, 2003, she had 1,000 nodules in her only remaining lung. That was the darkest period for sure.
It's like the whole world just collapses around you when your child is threatened.
I was living in terror that she was going to die.
My children were very young. They had a general knowledge that something was wrong.
They started, both of the children, as soon as possible with grief counseling.
I think Davis and I both were so afraid that we were going to lose her.
My kids were completely my source of motivation for coming through this. I knew that I had to do whatever I possibly could to be here to raise them.
University of Alabama, Birmingham had just published a series and said that transplanting BAC, which is bronchoalveolar lung cancer, was a viable option in young people.
We went straight to Mayo.
Mayo Clinic transplants more organs than any other center in the United States, and our Florida campus is one of the nation's leading lung transplant centers. We integrate clinical care, medical education, and research to move transplant medicine forward. Reagan's case was quite outside the box. We were willing to look for options since she was so young and had a young family, and she was otherwise an extremely healthy, actually very athletic kind of young lady.
I was told by Dr. Keller that There were only a very few transplants that had been done for the type of cancer that I had.
In her particular case, for this reason for transplantation, 50% of the people relapse. And so Cesar knew that.
He proposed that they try something new, and that was during my surgery to wash or rinse out my remaining native airways with a chemotherapy solution.
The unconventional approach, the unconventional thing about it was, well, what if the problem in fact is that there are remaining cancer cells in the airways? And what if we use something that may work on removing those cells? That could conceivably give the possibility that the tumor will not return. So we kind of had to figure out how to do that.
It had never been done before, not with chemo, but there wasn't a plan B.
Mayo was our only hope.
The phone rang, and Dr. Keller told me that there was a lung that had come available.
The whole family mobilized.
That night, there were over 20 of us in the waiting room.
It was a very anxious time. You knew that it was your shot, but there was no guarantee that you were going to come out of the surgery alive.
Cesar came out and grabbed me, and I got to go in and watch, which I imagine not too many people get to watch their wife get a lung transplant. I don't recommend it.
Fortunately for us and for her and for her family and for everybody that knows her, she had an extremely good outcome.
We spent 6 nights in the hospital. We were home in a week, and we've never spent another night in the hospital. Cancer never came back. She's never had a complication. And then next thing you know, 10 years goes by.
And that was the first and last transplant that we did for that indication. And the reason is because the year after her transplant, the lung allocation system changed, so patients with similar conditions like her will no longer qualify to be listed. Was it that we just had a lot of luck? Which could have been, and if that's the case, great. Or was it that having that lavage done certainly will have a long-lasting effect in a reproducible manner? That's what we don't know. We don't know because the circumstances did not allow us to repeat the experience again. And that's where we are today.
My wife is living proof that trying new things can help save lives.
A new building is being constructed on Mayo Clinic's Florida campus to apply new technology so previously unusable donor lungs can be transplanted. Our goal is help people across the Southeast who are desperately awaiting a lung transplant. If that technology fulfills the promise of bringing more lungs available for everybody, we'll once again make cases like Reagan's a consideration for transplant.
I mean, it'll save thousands of lives.
Dr. Keller is one of the kindest, most respected people in my life.
As she got better, things started moving back towards a normal life.
My mom used to throw me the most outrageous, over-the-top birthday parties that anyone could ever have.
She was the one that pushed me towards student government and towards facing my fear of public speaking. And that was one of the biggest moments of my life.
My mom is so brave.
She is passionate, she is strong.
She's a fighter. My mom is my favorite person. She's like my best friend. I'm sorry.
I was praying for one more month of having my daughter. 10 years later, I see these children and how wonderful they are, and I know it's because they've had her the last 10 years. It changed our whole lives.
I have had 11 and a half years of birthdays, anniversaries, celebrations that I would not have had. I've been able to be a daughter to my parents, and a wife to my husband, and a mother to my children. It's an amazing gift that I'll never be able to repay.